More than 90% of the lead in our body is stored in our bones, the safe place until we reach menopause or until we have osteoporosis. And the bones are repositories for metals, especially lead. So now this leads us to, like, why do women in menopause have higher levels of metals? Right? So as we age, we become our own risk of lead exposure due to the trabecular bone, the long bones, the thighs, the legs starting to turn over. So women with osteoporosis can lose an average of 3% of their bone mass a year. And women who don't have osteoporosis, they're postmenopause, they can also lose a percentage of their bone mass each year. In fact, there was a study of around 3,000 women, and it found a highly significant increase in lead after menopause. And it gave evidence that lead is stored in the bones and is mobilized into the blood. And so then there was a major implication of this study, and they talked about it in the study. The finding was that chronic low levels of lead exposure can result in increased body burdens of lead, and they said in the research, which would be releasable in toxicologically significant amounts when bone is in flux. So we're not just talking about lead, we're talking about mercury and cadmium also. They also get stored in the bones, but lead is the one that gets stored in the bones the most.